Hello, everyone. Today I have Dr. Bethany Verkamp with me, and she's going to talk about a really significant project that she's been working on. And so, Bethany, thank you so much for being with me today.
Yeah, thank you so much for having me. I'm excited to
Yeah.
share our work.
Yeah. Can you start out by just telling us a little bit about who you are, where you work, what you do?
Yeah. So I am currently a third year clinical hematology oncology fellow at Cincinnati Childrens. I'm originally from Arkansas, but I moved to Cincinnati about 5 or 5.5 years ago now. I did residency here and then stayed for fellowship, and I will fortunately be able to stay after fellowship, and I'll be joining the transplant team. And I'm mostly interested in HLH and bone marrow transplant.
Excellent. Great. Well, you recently had a paper that is entitled Emapalumab Therapy for Hemophagocytic Lymphohistiocytosis Prior to Reduced Intensity Transplantation Improves Chimerism. Is that how you say that?
Yes, chimerism. A mouthful of a title, but yes.
It is a mouthful of a title. But can you share a little bit more about what inspired this project initially, kind of what the background is that led to this study taking place?
Yeah, for sure. So I work with mostly with Dr. Michael Jordan, who is an expert in HLH, and I joined his lab during fellowship. I personally am interested in HLH and transplant, as I mentioned, but I can't take credit for the initial idea of this study. He had been treating clinically several patients with HLH and had kind of noticed that it seemed like the survival had improved over time, and it seemed that more in the Emapalumab era that we were having less incidents of mixed chimerism. And then kind of separately, Dr. Sonata Jodell, who does most of our work in transplant-associated TMA, had kind of felt like clinically the HLH patients who had previously received Emapalumab seemed to be a little easier to control their TMA. So kind of they both had these separate thoughts and then eventually decided to kind of combine forces and felt like we finally had enough Emapalumab patients that had gone through transplant that we could do a meaningful analysis. And then I was just lucky enough that they knew it kind of lined up perfectly with my interest. So I was asked to help kind of record the data and lead the analysis. But those two definitely have the credit for the initial idea.
Great. What did you discover as key findings through this work?
Yeah, I think the biggest finding is definitely the relation to improvement in chimerism. So, there's a lot of debate about conditioning regimens in the setting of HLH and using reduced intensity versus more myeloablative, knowing that reduced intensity led to a big problem with mixed chimerism and later graft failure. So I think the biggest improvement in the study is that less patients are having significant mixed chimerism, and we're able to avoid second transplant. We're able to avoid a lot of procedures that is a lot for the patients and the families. And so I think that's the biggest piece that we found looking at it is how it appears that imapalumab is improving the mixed chimerism issue.
Awesome. Well, you kind of touched on it a little bit already, but what are the future implications of this study and how will this affect the patient community?
Yeah, so our center is definitely being very mindful about incorporating imapalumab through conditioning. We pretty frequently use imapalumab in our HLH patients, but didn't have a clear kind of plan or consensus as for when you stop that in the transplant process. So on our study, it's quite variable when patients received their last dose, since it was a retrospective study. But based off of these findings, we've more recently been mindful in giving at least one more dose of imapalumab right before the cells are infused. So usually around sometime between day minus three, day minus one. We've definitely been doing that for our HLH patients, and in some patients with other kind of immune dysregulations, it's at least strongly considered to kind of help get that graft in and hopefully help prevent later mixed chimerism.
That's fantastic. It sounds like this could have significant implications in the future. So, really excited about this work and hope to keep hearing about how this progresses. So, what are the next steps for this?
That's a really good question. I think, the more we can kind of clinically record and analyze this and see if it's transferable to other centers. And, ideally we could do a prospective study, but of course, that's easier said than done. I think some other kind of background things that we're working on is this kind of gave us an insight into what might be the mechanism behind mixed chimerism. And it at least suggests that it's something that is occurring during the time of stem cell infusion rather than later on in the post transplant course. So we're working on some projects to kind of look at levels around the time of transplant and how they correlate with later outcomes as far as like interferon gamma and things like that. So that's kind of something we're working on to try to look at a little more deeply is can we figure out the mechanism of mixed chimerism?
Excellent. Is there anything else that you want to share about the project that we didn't cover, or
I think
anything
we
at all?
covered the kind of big things. I think one other thing is it was extra notable in the kind of infant population. So we had similar findings in patients under the age of 12 months, and we know that in infants, mixed chimerism is an even higher risk than it is in teenagers or older kids. And so I think we were really impressed by how little mixed chimerism we had in that population, knowing kind of how high risk it is. So I think it's something that's worth even more strongly considering in younger patients and something that we really need to keep looking into.
Great. Well, we will definitely be following this, and maybe we can come back at another time and follow up and see how things have progressed.
Yeah, that
So,
would be great. Thank you so much for giving us this opportunity.